And you're on.
Hi, I'm Will Hall, and I'm here in New York as a lecturer in the 64th Annual American Psychiatric Association Institute on Psychiatric Services. And I'm a therapist and a teacher, and I'm also someone who's diagnosed with schizoaffective disorder, schizophrenia. And we had a packed room talking about alternative and innovative practices to improve recovery outcomes. I've been studying a lot of different ways that we can help people who are diagnosed with schizophrenia and bipolar and struggling with psychosis to overcome and move on with their lives. And first of all, the message is that can happen. There's a lot of research supporting that people do recover, and it depends and it's difficult and different people have different experiences, but the research is very consistent that people do recover from a diagnosis of schizophrenia, bipolar, or psychosis. And there are a number of very innovative programs around the world that are supporting recovery because the recovery rates are really very low in traditional treatment settings. People are told that you're not going to recover, that you have to be on medication for the rest of your life. Well, I don't take medication. I was on disability check and now I'm not on disability. I've re-entered society. I no longer have that identity of a mental patient. And there are a lot of programs that are emerging that can really support better outcomes. One of them is the Open Dialogue Project in Western Finland, where they're getting very, very high success rates. People going back to work, people not on disability. And also another project was the Soteria Project in California in the 70s, also helping people to not be in the hospital. Very good success rates. What was common to both of those approaches was a low use of neuroleptic antipsychotic medication and the expectation that people could get better, and very relationship oriented, really connecting with people and supporting them through something, seeing it as episodic, understanding what they were experiencing as unusual, but also just a normal part of what people go through. Whenever someone is sleep deprived, they risk going into an extreme state. That's true of everyone, and that's often the root of people's manic psychosis. And when people are struggling with schizophrenia or struggling with other experiences, often there's trauma or abuse, and people can work through these things. They just need the right kind of setting. And I'm a very strong believer in the peer recovery movement, that if we can get more stories of people who have recovered, who've been in hospitals, been on medication, who've moved on with their lives, who've started working, who've returned to society, if we can get more stories of that out, then we will create a better atmosphere, and that in and of itself will help people recover. So there's a lot more to say about this. Just check out my website, which is willhall.net. I'm also the host of a radio show called Madness Radio, and you can check out madnessradio.net.
Thank you.